Environmental health consists of preventing or controlling disease. Maintaining a healthy environment is central to increasing the quality of life. Globally, nearly 25% of all deaths and the total disease burden can contribute to the environmental factors. Reducing exposure to hazardous waste is fundamental to environmental health. Protecting our water sources and minimizing exposure to contaminated water are important for maintaining good health. Poor air quality is linked to premature death, cancer, long-term damage to respiratory and cardiovascular systems. The question is, who is responsible for ensuring our environment is kept clean?
The environment plays a major role in our health and well-being. The interface between communities and the environment is what determines environmental health. Poor environmental health conditions, often coupled with poverty-ridden and poorly informed communities, leads to poor health outcomes. Conversely, an improvement to environmental hygiene contributes to better health. According to the World Health Organization, environmental factors influence 85 out of 102 categories of disease and injuries listed on the World Health Report. 13 million deaths could be prevented every year by just making our environment healthier. So today we focus on environmental health. We will look at common environmental health issues such as water quality, food control, waste disposal, vector control, and air pollution. At the end of the show, you'll hopefully be well endowed with knowledge on how authorities keep our environment healthy, but also what your contribution can be in that regard. Interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk, including our email address, healthtalk@sabc.co.za. I'm Dr. Sello Mutaung, and this is Health Talk. The major cause of diarrheal disease, environmental factors such as unsafe water and air pollution. So environmental management could prevent 94% of all deaths from diarrheal disease. To enlighten us on how this can be achieved, we have some special guests. First up is Mr. Zanuzugo Mbani. Mr. Zanuzugo Mbani is an environmental health practitioner and is manager of environmental health services in the city of Joburg. And we also have Dr. Tulim Dluli, who is a National Air Quality Officer from the Department of Environmental Affairs. Ladies and gentlemen, welcome to Health Talk.
Thank you.
Okay, in my introduction, I mentioned, diarrheal diseases. Clearly, we worry when some of the disease burden, can be related to poor environment. An example that we cited here is, unsafe water leading to diarrheal disease that kill innocent young children up to the age of 5. Maybe let me start with you, Dr. Mdluli. In terms of policy now, I'm sure that there would be laws or regulations that govern the quality of our water generally. Take us through some of these policy issues.
I'll take you through the Air Quality Act. We have very comprehensive legislation in South Africa governing air quality. Mm-hmm. We've got the National Environmental Management Air Quality Act, and we've got sub-regulations. We have, the minister has established what safe levels of air are in South Africa, which we call the National Ambient Air Quality Standards. Yeah. We also have industrial limits for industries operating in the country, different limits for major industries and smaller industries. We have dust control regulations and other strategies.
Yeah. Okay. And when it comes to now implementation of these, so government lays down policy, and implementation is at the level of obviously municipalities, which brings in Mr. Mbani. Mr. Mbani, maybe just take us through what your responsibilities are within the city of Joburg when it comes to issues of environmental health.
Thank you, Doc, for having me on the studio today. Yeah. From the city level, environmental health practitioners are responsible to make sure that the water that is consumed by our community is of good quality. So on regular basis, I can say maybe on monthly basis, we go out, take samples from all our streams, take samples for the potable water to make sure that we send it to the lab where they analyze those samples for bacteriological sampling, chemical issues, as well as forensic at some stage. So on regular basis, we make sure that our water is of good quality.
Okay. We've obviously made strides, since 1994 in terms of, ensuring that communities have, running water from the taps. But very often you get stories that this very tap water oftentimes is contaminated with, you hear things like E. coli and that sort of thing. What is the extent of the problem? And why is it there in the first place?
Thank you, Doc. I can assure you right now, when it comes to our water, especially for the household one, we've never experienced any of such cases. But I cannot be complacent on the issue. It might happen that when they are doing some construction wherever there is a burst pipe, it might happen that some of the dirty water can go through to our system to contaminate, the pipes. But our water is of good quality. As I've indicated before, it is analyzed, checked on regular basis. I mean, look, clearly you do get some media reports sometimes that would say, look, we've done random tests on water, and water, tested positive, excuse me, for E. coli. Are you then therefore saying that these are often, isolated cases, or just? Yes,
I mean, you're quite emphatic about the fact that it doesn't happen at all.
Those are isolated cases, maybe from other areas outside of the city of Johannesburg, but within our jurisdiction of the city of Johannesburg, we've never experienced any such cases.
Right. Your perspective now, looking at it from, government side, from the Department of Environmental Affairs, who does the monitoring? I mean, or what sort of monitoring do you do at your level, perhaps?
I will talk about air quality. We have monitoring stations. But in terms of the legislation, it's the municipalities and the provinces that must do the monitoring and report against the ambient air quality standards, so that we can inform people about whether we are compliant or not.
Obviously, we can relate it, Mr. Mbane, to what she's saying about the air. I mean, we're going to talk about air a bit later on. But in terms of monitoring now, you said that you ensure that the water is of good quality.
Yes.
All right. How do you monitor that?
What we have done, we take random sampling from our reservoirs, from our standpipes.
So this is the one that you're talking about now, to say on a monthly basis?
Yes.
Oh, I see.
That is what we are doing.
So
we've got, we are also concerned about people that are using boreholes. We also take care of the boreholes. We sample their boreholes, especially for those that are using the water from the borehole for human consumption. Well,
let's talk about that. I mean, there's quite a few people that find it cheaper, they say, to have boreholes in their properties. And which is somehow connected to their own, plumbing system within their properties. Now, how then do you actually come into people's properties to check this water? How do you do it?
Yes, we do have our own database exactly to know where do we have those boreholes. We make sure that a person has a certificate exempted to use that water for human consumption. Then on those regular basis, on monthly basis, we go out, our inspectors go out and take samples to make sure that all the time is of good quality.
Perhaps related to that is rainwater. People often, collect rainwater. And again, because, they find it cheaper to do that. How safe is it for consumption?
Rainwater, I cannot say is safe for now, but we always educate our public to make sure that before they use such water, they must use either boil the water or make sure that they put some jig on it. It's 1 teaspoon of jig in a 20-liter container to make sure that at least it is good for human consumption.
I see. Now, obviously the fortunate ones and the greater majority of our population will have tap water. Some of them will collect, I've spoken obviously about bore water and the rainwater. But some people don't have access to running water. And they rely on water from the rivers and, streams or rivulets or whatever. Now, from the municipality, I mean, you have lots of informal settlements, as you would know, that crop up, everywhere. How then do you ensure that such communities at least have safe access to water? And in the meantime, before that happens, what do you do to ensure that at least what they take in is safe?
Okay, I will speak for the city of Johannesburg.
Right.
We might be aware that we've got so many informal settlements around our jurisdiction.
Right.
But for each and every informal settlement, when it has been established, whether illegal or legally, our inspectors go through, make sure that they calculate the households to check how many people are in those informal settlements. By doing that, we send the information to Johannesburg Water, who are the custodians of providing water to our communities, to say this community need to have potable water in order to survive. So within our jurisdiction, we've never experienced any such incidents whereby people are fetching water from the river. Yes, it happens at the rural areas, but within the city of Johannesburg, we don't have such cases.
Okay, so your advice then to those that rely on water from the rivers, how can they ensure that at least they keep it clean?
To those ones, as I've indicated before, you either boil water before you use, or you take a 20 liter of a container, you put a teaspoon of a jig, leave that water at least for an hour, then after that you can use.
Okay, wise advice. We're just going to have to leave it here because we have to go for a quick commercial break. When we return, we look at waste management. Please stay with us.
The judge slammed corruption in both the private and public sector. Referring to irregular and wasteful government expenditure, he said it could no longer go on.
The high-profile corruption scandal has dominated Spain's headlines in recent weeks. The scandal touching a nerve as Spain emerges from its downturn after a slew of corruption cases involving politicians and the king's sister.
Tourism is a vital part of the economy. It contributes about 5% to the country's GDP and is a significant contributor to various industries such as food production, retail and transport.
For all your business news, stay tuned to your favorite channel, SABC News, at 1 Monday to Friday.
Imagine we would throw garbage, junk and rubbish away anyhow. Imagine there was no authority to supervise waste management activities from all the sources. Waste management simply means managing and monitoring of waste materials to minimize its consequences on humans and the environment. Proper waste disposal is crucial due to the fact that certain type of waste can be hazardous and can contaminate the environment if not handled properly. Waste has been a major environmental issue everywhere since the Industrial Revolution. Besides the waste we create at home, school and other public places, there are also those from hospitals. Medical waste, also known as red bag waste, mostly dumped near a riverside, include dangerous objects such as needles and medical instruments. In some parts of the rural areas, riversides are used as water resources and parents are concerned about the safety of their kids.
We are sad. We don't know what we will do. We thought the clinic was responsible for the waste. When we see the medical instruments, we usually tell our children not to play near the site. They usually put the instruments in their mouths and they might get infections, and we feel it's our fault that they play with the waste.
All these types of waste also have the potential to cause diseases or get into water supplies. There are rules and regulations in place for how specific types of waste should be disposed of.
In 2008, on the occasion of the International Year of Sanitation, the DG of the World Health Organization was quoted as saying, and I quote, "Lack of sanitation kills. It degrades health, especially that of children, and undermines education. It affects whole communities, but consistently those most severely affected are the poor and disadvantaged." Now, to further understand how waste disposal can affect the environment and, of course, health, we still have Mr. Zanozugo Mbane, who is Manager of Environmental Health Services in the city of Joburg. And we're now joined by Dr. Bobby Peak, who's Director of Ground Works. Welcome to Health Talk, Dr.
Thank you for having me on.
Right. We're talking now about, waste management, sanitation. Perhaps from your perspective, do we have a problem? I'm asking an obvious question. Do we have a problem of waste in this country?
Yeah, we do. We have, I think, a very serious problem of waste, and it is rooted in how the apartheid system created townships and how it provided services for people.
Right.
So today we still have a lack of waste removal services in townships in South Africa, whereas the suburbs will get waste removal regularly.
Right.
And we know if you have waste collecting in the townships, you have rats appearing around the waste.
Yeah.
Rats are vectors, they carry disease, and so children will be affected. So we have to, at a very urgent level, under the Waste Act and the National Waste Management Strategy that is looking at providing these services, get local government to secure services for townships.
Right.
That's the first thing. Okay. The second thing is that in South Africa, believe it or not, the majority of waste in South Africa is not governed by the Waste Act, and that is mining waste.
Yeah.
So when we look at River Lee and Soweto, that is on the banks or at the bottom of gold dump sites, which have uranium and other chemicals in it, people suffer in these areas because of that waste. Asbestosis in Penge, in the Northern Cape, we have lots of cases of death. There's been international court cases around that. And what is that? That's asbestos waste. But what the Chamber of Mines has done effectively is put pressure on government to declare mining waste as a material that can be used in future. And so as a result of that, we have this waste impacting upon people, and it is really critical that the Department of Health steps in.
Okay. Let's hear from somebody from the city of Joburg. Now, from your perspective, clearly there is a problem. You don't need to even read papers or go and research. You just need to drive around and you see the problem. And there was reference to domestic waste and there was also reference to some industrial waste. What are the challenges that are facing the city of Joburg in terms of waste?
Thank you, Doc, once more. When it comes to waste, what I want to highlight is that waste is a responsibility for all of us,
right,
both the council as well as the community themselves. We've got a municipal-owned entity which is responsible for removing our waste, which is Pick It Up. So as health department, on regular basis, when we go out, we identify those vacant lands where people used to go and do the regular illegal dumping. So that illegal dumping itself leads to the harboring of rodents, then people start to have diseases. So what we are doing as a city of Johannesburg from health point of view, we have opened a register to have all the illegal dumping vacant lands. What we are intending to do, every year we want to limit those stands about 50%. When we limit those stands, we're not just going to clean the stands. We want to check who is the owner of the stand. Why is the person not taking care of the stand? Because that is where people get a loophole now to do the illegal dumping. Once we've got the owner, whether the owner can clean or not, what we are doing, we clean on behalf of that individual, and later on, we claim back the money. So in a nutshell, that is what we are doing currently to make sure that we live in a clean environment.
Of course, I appreciate that it's some attempt, but how about going a step back and looking at why people come and dump there in the first place, and who are those people that are dumping there? Okay. I assume in this instance we're talking domestic waste, because we'll get back to the industrial waste, because that's another, a huge problem.
I think firstly, Doc, it's a lack of education.
Yeah.
Our people, they thought maybe if they take a rubble to a corner stand, it's no longer going to be a problem for him, because he's staying about 5 kilometers or 500 meters away from that stand. But if we can educate our people to say, guys, whether you've got so much tons of waste in your yard, why can't you wait until pick it up, remove that waste? Because at times everybody's got a wheelie bin up of about 200 liters of So I can say, in an essence, it's a lack of education from our people. They don't realize what are the after effects. So environmental health, as we are trained, we have to educate our public to say the way that we are polluting the environment, you must be aware that the same environment can become harmful to your own health. Yes.
Dr. Pick, your comment?
Well, I don't think it's a lack of education amongst our people. I think our people are educated. I just spent last weekend at a funeral in the deep Transkei, where the roads were, dirt roads, and it took me hours to get there. But in this little village I was in, the place was clean. There was no paper on the ground. There was no plastic all over. That is, people took, and there was no services, by the way. That was the interesting thing, rural Transkei. Yeah. But you come to Johannesburg, and I think the critical thing in any city and in any town is that when we spend money on services, we're still not spending money on the poor. And a simple solution is pick it up to go into the poor urban areas and clean it up. Right. For instance, if you leave a black bag in a suburb on the side, pick it up, we'll come pick it up. Yes, we'll stay there for 2 days or 3 days, but pick it up, we'll come pick it up. Right. But not in the township. Then you get one bag, then another person will put another bag, and then it becomes a mini dump site. So I think the responsibility lies within the system and within government to provide services for the poor.
But isn't there also two issues here? I mean, the one one could argue is the resources to be able to do that, and perhaps we shouldn't, speak for them, but put the question through to them, to Mr. Mavet. And the other could be behavioral issues. I mean, not so much. Maybe I agree with you that it's not so much education, but behavioral issues. People who just don't worry about other people. Yeah. They would want to keep their own yards clean, but don't worry about, how the neighbor is affected or anybody else down the street and so on. Your comment?
So, I mean, very quickly, I think resources, yes, we have a limitation of resources in terms of local government, but I think if you just look at the type of resources we put into suburbs, previously white suburbs, as opposed to what we put into black suburbs or black townships, you still see a discrepancy. Okay. And for me, that's important. And, white people need to recognize your rates, and the rich people need to recognize your rates needs to help the poor. And our government must do that. We mustn't be shy of that. And the second thing, in terms of behavior, yes, I think there is an important level of behavior but I think it's very much also in the urban areas. Yeah. Once you get into the urban area, it's chaos. Yeah. And then people just following that chaos. Yeah. So I think as indigenous black people in Africa, we know how to manage our environments. Yeah. But once you get into an urban area, all hell breaks loose, and then your behavior does change. Yeah. So you're right, we need to get a behavioral change in the urban areas. Okay,
maybe let's get a view from the city of Joburg.
Thank you, Doc, once more. I ought to differ a bit with Doc next to me. Yeah. When it comes to education, yes, there is still a lack of education from our people. Yeah. Why am I saying that? When we go around and check those illegal dumping vacant lands, you will find that we will clean today in the morning, but come at night, the following day, the stand is back to square one.
Yeah, but there, Mr. Mani, if you don't. A minute ago, I said, take a step back. Yeah. Look at who is actually bringing the dump there. Yes. If you just remove the dump and you don't stop the people from coming to dump, you're kind of working backwards, isn't that so?
Hence I was saying, Doc, it's education and law enforcement. Right. We do have an angle of law enforcement. Right. After we have cleaned the stand, we make sure that we put up the board, which indicates that there's no dumping supposed to take place in that particular stand. Yeah. Once a person get caught busy dumping in that stand, the person can be taken through the route of a court. Right. We've got our Metro Police Division that is looking at the bylaws regarding waste. Right. So the services are there, but it's just the ignorance of our people not to adhere to those laws. Yes.
Yeah. Okay, we'll continue this discussion after the break because we just need to go for a quick commercial break. Please stay with us.
Didier Drogba, a footballer from Ivory Coast, was named as the third most influential celebrity in Africa.
Where I saw him display, he's a very nice player. He always make an impact.
Drogba donated his $5 million endorsement fee to the construction of a hospital in Abidjan.
Well, there are some lesser-known football stars in the continent that you haven't met.
Really?
And are deserving of more attention.
I think we will do better.
The Journal, every Saturday at 1:30 on SABC News.
Every city has a problem with rats. Rats have been a pest in domestic areas for centuries, but with growing urbanization, with more people moving into the city, and poorer states of houses, the rat population is growing in numbers, affecting the health of human beings.
Rats are a problem. I wish we could get some help because it doesn't end there. The rats that are around here, they are really a hazard to the community. Even to anybody, a rat is not supposed to be in the house.
It has been reported in townships like Alexandra, north of Johannesburg, that babies, the homeless, and the old are being bitten by rats in their sleep. Poor waste management, hygiene are some of the root causes that could lead to an outbreak of the bubonic plague.
Rodents are found in every city in the world, and they have population densities that explode and retract and contract and that kind of thing. So it's kind of natural that you're going to find rats everywhere just because there's food available for them.
As the rats are posing an increasing threat to poor communities in the city, especially in the surrounding townships and suburbs, various methods introduced by the local government are proving to be a challenging solution for people to rid themselves of rats and other vectors.
There's children arriving at hospitals in this country every year that have eaten rat poison, and there's children that have died from eating rat poison. So don't use poison. Look at controls that are to do with change of the way we live, manage our litter, and in townships that's difficult because people essentially don't feel at home there.
Jonathan Hall, a member of Eco Solution, introduced the use of owls at schools to deal with their rodent problems.
The township project itself started in 1998 in Sebokeng, and Alex has been running for about 2 years now. It's actually the township owl project has involved 83,000 children in the last 10 years and schools where they do these owl releases. But Alex is about 3-year-old project.
The students in local schools seem to have welcomed the ecological method of the use of owls to help them kill the rats. The situation of overcrowding and poor waste management contributes to the increasing population of rodents and other diseases-carrying vectors in urban settlements like Alexandra Township.
When you walk through at night, it's like an army of rats that attacks you. From black and white to star white and even star black, you find it in different colors. When they walk on top of your roof, you'll think a dog or an elephant is walking through it.
People dumping, excreting drainage and polluted water into Jaskei River that runs along Alexandra Township are just some of the causes for the increased number of diseases in the area. One huge problem is that the communities need to take responsibility for their surroundings and not only rely on local authorities to keep their area clean.
Now, amongst many other sources, illegal waste disposal is often a breeding ground for some undesirable rodents, as you heard earlier. Some are so brazen that they somehow make their way to public hospitals and wreak havoc. If not scaring the daylights out of some unsuspecting nursing staff, these rodents often interfere with the very limited medicine stocks in some of these hospitals. However, the worrying aspect for me is that these rodents act as vectors for transmission of disease to humans. Now let's understand how these can be controlled. And we still have from the city of Joburg, Mr. Zanozugo Mbane, and we're now joined by another environmental health practitioner. We spoke earlier about hospitals. This time she's from the Department of Health. She's an environmental health practitioner, also from the Institute for Environmental Health. And this is Simpiwe Mbata. Welcome to Health Talk, ma'am.
Thank you.
We spoke earlier on about waste disposal and how this is a breeding ground for rodents.
Yes.
Okay. Take us through, from your perspective now, what is the issue or what is the extent of the problem when it comes to rodents that creep up from these dumps?
I will tell you that usually when there is illegal dumping, so it's automatically it becomes the area where you'll find that there are rodents, there are cockroaches, there's smell, odor, and then there's flies and other diseases that you can get from that area. But usually the rodents, they will feed from that area, and when they feed, they don't care what they are taking. And then it will happen that some of it, after feeding itself in that illegal dumping area, it will via to the household. And what it does, it does carry some diseases. Then at night or during the day, you will find that it will bite, especially the kids.
Well, this is a worrying factor because
especially the kids,
sometimes when you drive around in the city, I mean, you see some of the largest rats ever, that we've never seen before. And I mean, I just quoted an instance where you see these rats in hospitals. Maybe let's get a view from you in terms of now. Clearly, there's a problem. How can we ensure? What are you doing, at least at your level, to ensure that you get rid of firstly, obviously, the source, and secondly, the rodents themselves?
All right. Thank you, Doc, once more. From the City of Johannesburg point of view, I've indicated before that we've identified all the illegal dumping hotspots.
Right.
So the first thing to do is to remove food for these rodents. Because if we can make sure that we eradicate all our illegal dumping sites, then there will be no place where they can feed these rodents. Secondly, when it comes to the rodents themselves, we've got a program that we are busy working on, which is distribution of owls.
Owls?
Yes.
Interesting.
So these owls are being bred at Alexander, which is region E according to our regions in the city of Johannesburg. At night, these owls are released to go and hunt for their food. So the most food that they are looking for are these rodents, which are called rats.
Not humans.
Yes. So by doing that, that is one step forward for us to make sure that we eradicate these rodents. Number two, we've got our pest control division, which is working very hard on daily basis, not even on weekly, on daily basis. They go out, especially on the informal settlement, where they do the spraying and fumigation. So to make sure that all the time there's no rest that is starting to crop up, So that is the list that we are doing at the moment.
Do you identify hotspots, as it were?
Each region has its own register with the hotspots, which is monitored by our central office. On monthly basis, we report to say, from the hotspots that we have identified, what is the progress there? So we close those holes, we make sure that there's nothing left.
You mentioned rats. Are there any other rodents that you worry about?
Other rodents that we are worried about, it's flies. We are worried about cockroaches, which migrate from one house to the other. With the cockroaches, what we have picked up, just like any other rodent, it can smell a food 7 kilometers away from where it is. So that is one point that we are busy working on. Yes.
Ma'am, hospitals. We hear stories of rodents, getting in to feed themselves on medicines and what have you. What is the extent of the problem in public hospitals?
Now our public hospitals are in a good state now, but you'll find that it's just you find that it's an incident, one and it's just a drop in the ocean. Why? Because you find that maybe it's a clinic or the hospital next to it. the community is dumping there.
Okay.
So once there's that dumping, I've said it, then they will feed, then they will go to either the clinic or the hospital if it's nearer.
Yeah.
So the only thing is that what we have done, we remove all those illegal dumping.
Okay.
But the main thing in order to control this is to start by educating the community, because it's us, the community, that are dumping illegally.
Yeah.
Remember, there's all municipalities, they've got their waste management plan.
Right.
They collect the waste once every week.
Right.
So there are those who find that their bins are not collected because that person was not at home when the municipality was collecting. Then they will just go anywhere and dump. So I think the first thing is that we need to teach the community, because they are the cause of this. So they need to control it. It must start, it's like they need to be educated in their behavior. Although behavioral change takes a long term, it's a long-term issue. But if they continue, we continue teaching them. Specifically, if you say hotspots, it's the areas where you find that go to the informal settlement. That's where you get rodents. Ne? Why? It's shack next to another shack. And what they do, those people, you find that there's no waste management. They like in an urban area or a township, because there's roads and everything. With them, there's no road, and they sell food to anyone. So you find that when they are busy with their thing, even it's chicken or whatever, they just throw anywhere. So if you start by educating those people, so that they can learn. And
but also maybe providing services to those people, isn't it? So
yeah.
Finding a way of providing services so that there's no incentive for people to kind of dump anyway, isn't it?
But what I like with this government is that they are trying to cut the informal settlement. Yeah. Remember, there's this plan where even in the urban area, they build the RDP houses, but they match the standard. It's not a low cost. It matches the standard. Then they are removing them one by one. I know in Tshwane they are doing it at the municipality of Tshwane, in conjunction with the provincial Department of Human Settlement. Yeah. They are removing those people. Like there are areas like Lady Selborne. They are in RDP houses, but you won't see that there are RDP houses, because it's like it's a townhouse if you see it, but it's a free RDP houses that are being given to either black or white community that are not working.
Okay, Mr. Mane, we've had lots of rains recently, and one of the major problems is mosquitoes. And basically because, especially where you find pooling of water and all of that. Now, what mechanisms are there to try and control the mosquito vectors?
Okay, thank you, Doc. Since we are on a rainy season now, and our grass is very long, so we make sure that we cut grass to a level of about 150 millimeters to make sure that those mosquitoes doesn't breed. At the same time, for our rivers and our dams, we take samples to make sure that the water is of good quality. So, and fumigation at the same time does also help us. That is what we are busy doing at the moment, to make sure that there's no mosquitoes that can breed. But the fortunate part is that when we talk of mosquitoes, South Africa, we are still lucky because we don't have the species that can cause the malaria.
Yeah, well, perhaps in Joburg, I would agree with you, but not so much in the northern Natal and
Limpopo, Mpumalanga, KZN, they have that malaria mosquitoes.
Okay. Yeah. Maybe you want to comment on how they control the vector, this fumigate and spray around households?
You know what they do, I'll just share the information because I once worked in Limpopo. What they do, in Zanini, there's specifically a head office of malaria control officers.
Okay. You know, because malaria is such a huge topic, maybe we'll leave that for another time. Let's stop at this point and go for a quick break. Stay with us.
One of the qualities I found in him is that he took his business as serious as I took mine.
When I see Kujo, I don't see disability. I see one of my boys. I work with him on any project because I believe in his input.
Diagnosed with osteogenesis imperfecta, commonly known as brittle bone disease, from a young age, Kujo knew that his winning ticket in life would be a positive mindset.
You'd work and the salary wasn't that good. That's when I saw that, let me start my own thing.
I come up with ideas and Kujo will put those ideas into marketing tools that I can use.
Join me, Refiwe Mwiba, on Bophelong, your show about those who take on and conquer life's challenges, every Saturday at 17:30.
In most recent research from the World Health Organization shows that pollution is responsible for 1 in 8 deaths globally. The Department of Environmental Affairs is dealing with the industrial companies that are not complying with South Africa's already weak air quality standards. Companies like Eskom, who are the country's main energy supplier, are emitting high levels of pollution, severely impacting people's health. A new study by the campaigning group Groundwork shows that it's the health and lives of people that live in the Highveld that are most affected by industrial air pollution.
I used to live next to a mine. Every now and then I kept buying medication, thinking my child had flu and stuff like that. When I went to the doctor discovered that my little boy had strong symptoms of asthma. He will have to take medication for the rest of his life. I was spending a whole lot of money on medication, and I was wondering that how many other people out there are like me.
South Africa's Highveld area has one of the world's highest air pollution levels due to health concerns. A part of it was declared a high priority area by government in recent years.
People tend to make the association between air pollution and respiratory effects much more easily than any other sort of outcome. This is because it's almost instant. You know, if you have a high level of pollution today, children are going to be complaining tomorrow or a few days later. But other outcomes that we are also concerned about, cardiovascular problems, so problems related to the heart, and also longer term effects such as cancers. We're also now becoming more concerned about reproductive effects, the effects that this may have on the on pregnant women, the unborn fetus.
Groundwork research also shows that residents in the Highveld priority area are more likely to die of respiratory or cardiovascular diseases due to heavy industrial air pollution.
And in addition to that, Highveld residents have the highest instance of burning coal in their homes. So they've got a double burden of indoor air pollution plus outdoor air pollution. And apart from moving away, they can't escape from Eskom's impact on their health.
The study shows that industrial air pollution is the primary driver of poor outdoor air quality in the Highveld priority area, having a much greater impact of people's health compared to outdoor air pollution from domestic burning of coal. The Department of Environmental Affairs is responsible for ensuring that the environment is not harmful to people's health.
We have the ambient air quality standards, which actually define what safe air is in South Africa. We also have standards for industries, big industries, who emit large amounts of pollution.
Even though the health impacts of air pollution are well known, and the Air Quality Act was passed to try and mitigate that and strengthen air pollution control, it's clear that the interests of the polluting industries override the public health concerns.
It's a common
reality that the young suffer and the aged suffer. But let's remember the young of today are the adults of tomorrow. We can say that the entire population is vulnerable because sick children become sick adults.
So, in simple terms, the air that we breathe is not safe for human health. Are we really living in a society which prioritizes human needs, or are we living in a society where we prioritize industries who are just around our communities to make profits and nobody worries about the social well-being of the people around?
If industry is allowed to continue polluting our air, people living in the Highveld area will continue to pay with their health and lives as the industry continues to pollute.
Okay, welcome back to our environmental health discussion. Now, if you're a city dweller like myself and open your windows in the morning to let in some fresh air, just how fresh is that air? The quality of air that you breathe in is just as important as nutrition and some medication in some instances, that you take to sustain life. It is an undisputed fact that air pollution plays a major role in development of respiratory illnesses in our society. Medicines alone cannot effectively deal with these illnesses if the environment, on the other hand, is polluted. Now, let's understand from our experts just how environmental pollution is managed. We have Dr. Bobby Peak, who's director at Groundwork, Friends of the Earth, South Africa, and Dr. Tulim Dluli, who's a quality officer, National Air Quality Officer at the Department of Environmental Affairs. Okay, welcome back after a short break. Okay, we spoke about air pollution. Okay, maybe let me start with you again, Dr. Peak. Air pollution clearly is a problem. People will tell you need to go to the countryside to go and breathe, cleaner air. And if you're living in the cities, the air isn't that great. What is the extent of our problem?
Well, I would even be cautious about going to the countryside because if you're going to Mpumalanga, which is homes 12 of Eskom's coal-fired power stations, we know that the air pollution in that area is severe. And 51% of the respiratory problems and the deaths by respiratory problems are caused because of the outdoor air pollution caused by Eskom. And 54% of the cardiovascular deaths are because of this air pollution as well, caused by Eskom. And we have a whole lot of other industries in the area. So that's a real issue. So we need to consider, and specifically because South Africa focuses on coal as an energy source, we need to consider how do we move away from coal. But in urban areas as well, in Zamdela, in Sasolburg, in South Durban, Merebank and Wentworth, we have very high respiratory challenges there. So 52% of the population, school population in South Durban have asthma. It's the highest in the world ever recorded. And they're living next to two oil refineries, Engen and Shell and BP on the one end. Leukemia rates in South Durban are 24 times higher than the national norm. And those things aren't acceptable. And that is all because of air pollution. And finally, if you live in these polluted areas, this is the thing that we have to take home as a health. You are in South Durban, your risk of cancer is 250 times the norm because you're living in an area where there's pollution. And so...
Well, that's worrying. And again, people don't have a choice, isn't that so? I mean, if you live in an area either because you're forced to live there because it's nearest to where you work and the environment is polluted, you don't have a choice. So maybe let's understand from government's perspective. How, in the first place, how is this regulated? Because clearly it points a finger to industry being responsible for polluting, the air. So please take us through the legal aspect now in terms of, how this is regulated.
Okay. We have the National Environmental Management Equality Act, which governs air quality in South Africa. We have defined safe air as ambient air quality standards at national level, which apply all over the country. We also we have industrial emission limits. We have other pieces of legislation that, for example, the dust control regulations. But in the areas where there is exceedances of the ambient air quality standards, the minister has declared those areas priority areas. So Mpumalanga, for example, falls within the priority area. We also have another one in the Vaal Triangle. And a proactive one in the Waterberg Bujanala region to deal with air quality problems before they actually emerge. But what we find in government, when we analyze the problem, we find that there's a mixture of sources in these areas. We have industrial sources, as Bobby indicates, but we also have a lot of fugitive emissions from mining operations, and you would know that there's a lot of mining taking place in these areas. We also have emissions from vehicles.
Yeah.
So the more you see traffic, the more there's emissions generated. Yeah. We have a lot of pollution from domestic burning in people's homes, which affects the health directly. So, I mean, it's a big problem that we need to address collectively.
Okay. I mean, on the one hand, and I appreciate this, that, you know, your responsibility is to look at the quality of air, I presume, you know, ensure that the quality is of such standards that it's at least healthy, you know. But what about looking at the other side to say, you know, if people continuously keep polluting the environment, sure, you can monitor and try whatever you can, you know, but if people keep polluting the environment, it's not going to help. So what efforts, or maybe put differently, if you say that an area has been declared a priority area, in practical terms, what does that mean?
It means that we have focused resources to deal with the problem in that area. But just to answer your first question, we have community programs where we have community workshops and share with people what they could do differently. Yeah. But in most cases, it's issues of energy poverty, really, if I can call it that, where people don't have a choice but to burn coal in their homes. It's not that people want to burn the coal, it's just that they don't have a choice. It's called they need to keep warm. Right. And so in that regard, we are taking a strategy to cabinet to deal with that problem, to ensure that the housing itself is adequate. It doesn't require people to need so much energy to keep warm, as well as the clean energy sources are also available to use. Yes.
Well, Dr. Peak made an example of, quoted, you know, the coal mining problem in Mpumalanga. Sure, I mean, we need energy, especially these days.
Yes.
But how can we ensure that whilst, you know, that continues, but it is done in a safe kind of way that doesn't affect the communities negatively?
Yes, we do need to do the economy in a sustainable manner, if I can loosely call it that.
Yeah.
There are technologies that industries can employ to use coal if need be, and use it sustainably, such that you can scrap the emissions and not put them into the atmosphere, because the challenge is once you have put emissions into the atmosphere, there's no mitigation. It's there for the people to breathe in. So what we try to ensure is that less goes into the air, because once it's in the air, it's in our lungs.
Dr. Peak, can the mining industries go green?
Well, you know, mining is not green. So, you know, as you can see, coal kill coal, you know. Look, I think the reality in South Africa is we're in transition. Yeah. So we can't just say stop coal today. And we all know that, and we respect that, and we know we have to move to a process where we work with less coal. Yeah. The reality, as the department itself has said, the burning of coal costs this government 4 billion rand every year because people are sick and they go to state institutions. The challenge that Dr. Thuli faces now, and we, you know, in support of her in this and the department, is that industry, Eskom and Sasol and a variety of other industries are applying to be exempt from the law. So they are polluting in excess of what they should be now, but in future they don't want to even meet the new standards that are coming into play on the 1st of April this year. So Sasol is taking government to court to say we don't want to meet that law that stops pollution coming out of our chimneys. Basically what they want to do, and I always say, is you got a speeding limit of 120 kilometers. Sasol and Eskom want to go at 360 kilometers an hour, and they don't want to be fined for doing that.
Yeah.
And so that is the challenge that we face now.
But isn't that about a balance now between, you know, sustaining, you know, the economy, ensuring that there's continuous, you know, job opportunities? Well, how do you strike that balance? I know that, I mean, it's an ethically difficult one even for me.
Yeah.
That, you know, how do you do that at the expense of the health of the people? But how can that balance be achieved?
And I think it's a really, really important question, because we need to think specifically, and as I said, I started off with the fact that it costs the taxpayer 4 billion rand every year. If Eskom does not meet the new standards, it's probably going to cost us in excess, in terms of health, of 250 billion rand. in health costs going forward over the next 20 years. So that's a big issue that the taxpayer will have to meet. So what we are saying to government over the next 10, 15 years, you need to start getting energy to homes that is not coal energy. You need to start building better homes. And Dr. Thuli mentioned a strategy about indoor air quality. What is really sad is that strategy was on the table about improving energy access for poor people and air pollution in poor people's homes already in 2000. And what has happened is it just sat. And the Department of Energy and the Department of Environment never pushed that through. Now we're in a crisis.
Let's get a response from her. Dr. Mdluli?
Look, I must say that the Air Quality Act came into force in 2010, the industrial emission limits. And at that time, there were industries that were existing. And so it came with transitional arrangements to say, how do you then allow these industries time to invest from where they are to comply into the future? And so those transitional arrangements are what Dr. Pick is talking about. The industries have applied to get a bit more time to come into compliance with the standards.
Just in 10 seconds, we've run out of time completely. Any hope for the future?
There is a hope. From the data that we're monitoring, we are seeing that there are reductions, not fast enough, not as well as we would like, but we are seeing that over time we are going to get into compliance.
5 seconds. Any hope?
I think what's really critical for poor people is our government and we need to get energy to people that is not based on coal and build better homes for people. And that's it. And do not break the law.
All right. There we're going to have to leave it, I'm afraid. Thank you very much for your contribution. Okay, it's on that note that we come to the end of our show today. And share your views and comments on Facebook by going to SABC Health Talk and like our page, of course. You can also follow us on Twitter at SABC Health Talk. Please drop us an email at healthtalk@sabc.co.za. Join us next week on SABC News, and of course you can watch the repeat shows at 2 p.m. and 10 p.m. tonight, or just simply get the show on the YouTube channel. So it's a warm goodbye from me, Dr. Solomon Taung, and the rest of the crew here. Thank you very much for watching Health Talk. Cheerio.
Eskom could miss a deadline for a crucial step towards turning on the Medupi power station. But the power utility says it will probably meet the December the 24th deadline.
We're looking good. We've come through 3 days, obviously, of load shedding, which has unfortunately been necessary, but it's been useful to have built up our reserves for the coming week.
Shares of private hospital group Netcare jumped up today and closed on a high after the company reported increased annual profits.
The hospital group is also taking steps to aggressively reduce its dependence on Eskom due to increasing power outages and rising costs.
We'll be reducing our energy needs by some 35% over the next 10 years, and our cumulative savings of our forecast electricity bill will be in the region of R1 billion. So we're doing something very constructive about the challenges we're facing at the moment.
That's Business News, weekdays at 6 p.m. on SABC News.
This is AM News live at 10:00 hours across all Central Africa regions. A very good morning to you on Valentine's Day edition. We have two